Kalami ke Kynnoh no nong thau ain ke Voice of the People Party na nongkrem constituency Bah Ardent mila bersayomwan ha kasngi ba ar ke dorbar mangtengka ke yeng dorbar thau ain ke jala ha ka arpoit rigluber arjar pulai bah ke Sorkar ka thmu ïalam bakla de ki jubab bam shai halor ke Kynnoh kerdan ya ke Mawryngkneng PHC shaka CHC Haswa kani ke Dr. Amprin Lingdo Menteri Badai yak tan ka koi kakhia haba jubab ik jingkli na wamele ke Mawryngkneng uba Havingstone Karpran kala pentip balapli ke Mawryngkneng CHC House nam arjar puar kala ong bakala tri kampura nadu kate ke pon rei kampat dan pat yu Dr. Specialist papura.
Honorable Speaker sir, reply to star question number 3A. Sir, CHC Mawryngkneng was upgraded from a PHC to a CHC on the 7th of September 2022. B. Sir, Mawryngkneng CHC is functioning as a full-fledged CHC, sir.
Mr. Speaker, sir.
Yes,
While appreciating the Honorable Minister in charge of Health and Family Affairs, as she has said that the CHC Mawryngkneng is functioning as a full-fledged CHC. So as per minimum norm of the CHC, it's required to be manned by 4 medical specialists, namely surgeon, physician, gynecologist and pediatrician. So I request the Honourable Minister to please keep the names.
Honorable Speaker sir, the CHC at Mawryngkneng at the moment does not have a full-fledged specialist. The medical officer, Dr. H.M. Kim, has proceeded for a pre-training program in Chennai, Tamil Nadu for 6 months with effect from the 3rd of February 2023. Medical officer, which is a floating post, Dr. Jeffrey Oswin Rinja, PG, is now undergoing a PG program at IMS Banaras Hindu University, Varanasi, sir.
Your second supplementary question, please.
Madam, are the equipments available according to the CHC norms, like X-ray, scanning, and an OT, labor room, laboratory facilities?
Sir, we have a functional OT for we have a functional OT there, sir, and unfortunately we don't have the manpower. We are yet to upgrade all of the equipment at the CHC center.
So according to the reply of the Honourable Minister in 3B, that Mawryngkneng CHC is functioning as a full-fledged CHC. And in her supplementary reply, it seems that the government is trying to mislead the House, sir, because in this reply, she said that CHC is functioning as a full-fledged CHC. But when we asked about the doctors who are supposed to be there as specialists, we asked about the equipments, it seems that they are not in place. So, is this not misleading the House, sir?
No, your question, please.
Yeah, that is my question, sir. Is this not misleading the House?
Sir, the
reply is clearly mentioned full-fledged. It's been working as a full-fledged. But when we ask about the minimum norms that are required to be there, the Minister seems to be not able to reply. So, may I know whether this is not misleading the House, sir?
So it's a matter of perception, sir.
It is
I
not.
have said that the health center, CHC at Mawryngkneng is functioning, which is what the question was. When asked about whether or not certain equipments were not there, or are they there, or are they functioning, I have said that some of the equipment need to be upgraded, and we are working on that. Number 3, the Mawryngkneng CHC center, sir, is a non-FRU, which means it is a first referral unit. So we have also said that we have other specialists who are there, not all specialists, because very recently there was a need to improve the numbers of specialists across the state of Meghalaya. An effort has been put and we are working on it. So question of misleading the House does not arise. Just for information, to the honorable member as to why we say that it is functioning. In between April 22 to February 2023, new ANC pregnant women registered in that CHC totals 536. 536 women registered themselves in that CHC, which shows that we are working. Yes, with some constraint because of some unavoidable circumstances, because we are upgrading the quality of the doctors posted in that CHC. Sir, we have also said that there are so many patients now that continuously register in that CHC. So it's a matter of perception. Yes, we may be falling short of certain services, but we are putting all efforts to ensure that that CHC becomes totally functional, sir.
Sir, I beg to disagree with the Honourable Minister that it's a matter of perception. I raised my supplementary question based on her reply in this August House. When we asked about the gynecologist, is there any gynecologist in that PAC? May I know the name? May I know the name of the pediatrician?
Sir, as is the case in several other health facilities across the state of Meghalaya, there is this need to ensure that all of the norms for CHC are adhered to. We have in the CHC 4 medical doctors, and like I said, 2 are out on training and will be back to their services at the earliest. So we've also said that the delivery room with an operational facility, which is the OT, is functional as a first referral unit.
So I just want to know the name of the gynecologist.
So the gynecologist is not yet in place. We have recently conducted an interview, and we have recently got these gynecologists. We are waiting for the procedures to be completed. We will be sending all of these specialists across CHCs, PHCs in the entire state, sir.
Yes, Bajaj, please.
So, the reply of the Honourable Minister, we have come to know that the PHC has been upgraded at Mawryngkneng to a CHC, and also there have been a number of pregnant women, more than 500, who have sought admission or perhaps treatment of some sorts. The question is to the Honourable Minister, in the absence of a gynecologist, would it be advisable to admit patients who need treatment as they are expectant mothers in the absence of a gynecologist? Will that be a prudent move, sir? That is my question.
Yes, sir. We are, these patients that are coming to the CHC, if there are complicated pregnancies, will be referred to a higher facility. Those that have come to the institution and have normal pregnancies will go ahead as per facilities available there.